Process for mole removal surgery. Now, either it can be again here surgical and non-surgical. So at CPLSS in Mumbai, we get lot of inquiries for mole removal. Moles are very common problem. Any good cosmetic and plastic surgeon will be able to handle these kind of problems very easily. Either we can do non-surgical methods like radio frequency or cauterization, or of course lasers, which are very popular, or surgical methods where we actually excise the mole and stitch it up, or we do minor flaps in order to cover the defects depending upon the size of the mole. So it depends on which area the mole is and how big it is. We will either do a surgical or non-surgical methods. If it is very small, have a thin base, some moles have a narrow base and they can be larger on top, then it's easier to do non-surgical methods. But if the mole is very deep, big, or it has a big base, then we have to do surgical methods, and hence you have to go to the best cosmetic and plastic surgeon to get these kind of things done. How long or what is the duration to perform these kind of mole removal surgeries is something that everybody wants to know. So now if there is a single mole, if it is a non-surgical method, it would take less than 5 minutes to do something like this. We have removed at CPLSS, we've removed moles, multiple moles, even around skin tags and moles which are like 150 in the body, and that would take a long time with laser and cautery. You do it one by one. So this kind of procedure will take a couple of hours, 2 to 3 hours to perform. Now if we are removing in a surgical way, then in that case your cosmetic and plastic surgeon will take some time in order to plan it properly and to remove the mole, and hence have practically in such a way that the suture line is practically invisible. So hence it would take maybe half an hour to 1 hour in order to perform these kind of procedures. Moles are notorious to come back if they are not excised properly, if there are some cells remaining behind deeper or in the tissue which you've left behind, then they come back. Otherwise too, if the body has a tendency, then the moles can come back. So you may need to repeatedly come and excise them at different stages. The moles come in different parts of the body. They're common on the neck, the face, thighs, back. All these areas are very common, and hence unfortunately, yes, they are notorious to come back.